prioritization as a congregate living setting it's a controversy in other states, and many other states have also prioritized them with other congregate living situations. They cannot control their environment in terms of shared surfaces, common items, the duration of greater than 10 or 15 minutes of contact each with the other. They cannot control that. They oftentimes have bunk mates, for example, in their same cell. And they spend the majority of their lives indoors. By definition, that's what jails are and prisons. Confined and not able to control, to be outside, for example, where they have less ability to get infected. But really another important issue, and it can't be forgotten, is that these congregate settings like this are put the community at risk. They put the non-incarcerated staff at risk. And especially when you go to those communities, and we know this very well because we've had so many outbreaks, it spreads into the communities as well. You might physically have a wall around a prison, but people come and go all the time. Many of the inmates on work release programs, they go from one jail to the next as part of their movement through the correctional system, whether it's in the county jails or in the Department of Corrections. So there's a terrific amount of movement into and out of. So it's felt that to eradicate the disease in the community, you have to get it in every congregate setting, including prisons. That's the reason that the justification from the CDC and from us.
So, Secretary, did I just hear you tell us that the CDC is recommending that prisoners be vaccinated? Is that correct?
They're recommending anybody in a congregate setting, and they don't necessarily tease it out as such.
So that is a decision made state by state, correct?
Yes, it is.
How many states have made that decision?
I don't know. We've talked about it on my calls, but I don't think that a straw poll has been taken of that.
Well, we don't rely on straw polls. Back to you, Senator Hildebrand.
Thank you, Madam Chair. And just kind of, you added a little question for me. If the state is going to shut down businesses and tell people who can and cannot work, and you just said that because we have work programs for prisoners, that they are going out in the community and possibly spreading this, why are we telling people to stay home and don't go to work and don't earn a living, but we're sending prisoners out and allowing them to work?
Well, a great example is a state fair, which relies heavily upon, of course it was canceled, but relies heavily on inmates because they're a very affordable form of work. So that meets a lot of the needs of many different employer communities. To my knowledge, there's no stay-at-home order that's in place that is impeding people from going to work.
So it's not about keeping the spread contained. It's about allowing inmates to get out and work for the state fair?
No, it's both. I mean, if employers in those communities want to have a work release program where inmates can go to work, it's meeting the needs of the employers. And we think it's important that they not bring illness into the work settings.
Yeah. I don't know if you've seen the latest unemployment numbers, but an article just came out today that Kansas has seen the most unemployment numbers since the pandemic started. So I'll move to my next question. Have you guys had any vaccines disposed of because of lack of storage, proper storage, or because they've been opened and not been able to be used completely?
To my knowledge, there has only been one instance, and that was relayed to me by one of our county health officers, of a hospital, and I don't even recall the name of the hospital in central Kansas, where 8 doses were not able to be, for whatever reason, were not able to be instilled into a patient during the window of time. But other than that, we haven't heard of any that were wasted, where there was any wastage.
Is KDHE giving counties and city health officials and hospitals the autonomy to, if they have to open up a vial and they do not have everybody that fits within that phase that they're supposed to inoculate, can they go, do they have the autonomy to then go to the next phase without wasting that vaccine?
Yeah, absolutely. They are given the autonomy to use that in a person that's not in the current phase that's we're in. So yes, they can give that.
The next one is part of communication. It's two parts. One is, how is KDHE going to communicate the vaccination when someone is up for phase 2? How do they know? How will the public know that they are available or eligible to go get vaccinated, and where to go get vaccinated? And the second part of that is it just going to be a state, or are counties and local governments going to have that communication tool as well?
Yes. Question number one is that the notification of kind of how we're doing as a state and when we well, first off, we don't have to move as an entire state lockstep at the same moment in time. Counties have the autonomy to move ahead once they've gone through their phase, in this case, phase 1. And if they have vaccine available, ready to go, they have the autonomy to go into phase 2. The public will know because, and this will be coming up in the not too distant future, will be press releases, will be information on our Kansas vaccine, that's one word, .gov website that says where we are and what phase as a county. And to part 2 of your first question is the map, which will be available very soon, will allow the user of to hover over the county or the city, and it'll have listed websites that they can click into to get information, phone numbers, registration for making an appointment to have the vaccine done. So it's a combination of written, spoken media, and press conferences will also talk about it, and the press will pick it up very rapidly, I'm sure, also. And the county health departments, of course, will be the first to know, but it'll all come out by way of press releases and the like.
Okay, thank you. What is the total number of both vaccines that Kansas currently has, and has there been a timeline discussed with the federal government on when new batches of vaccines are distributed, and how is it determined the number of vaccines that Kansas receives? The
total number of vaccines administered at this point in time, as of 9 this morning, is 125,479 doses. We've been distributed a little bit over 200,000. So our current administration rate is about 60% of the dose, and that's of the doses that have been sent out to the communities where they have filled out on the WebIZ and Vaccine Finder, which is a federal system. When they give somebody a vaccine, it has to be put into the system. We know more vaccine is getting into people's arms and that the data lags, which is true in every state. So we're right at about 60% of the doses have been sent out, have been administered. The U.S. average is 39% as of today.
Secretary, I understand that we have some of our medical professionals that are struggling with the WebIZ program. Are you not seeing that?
Yeah, we are. Matter of fact, I was just on a call with hospitals again today, larger hospitals. Last week was the smaller hospitals, and occasional ones are struggling with it. And it's particularly in those facilities that are not accustomed to it. Because, hospitals aren't a big place for getting immunizations. It's usually done in ambulatory settings, public health departments, FQHCs and the like. So we are trying to help them. Eventually, the amount of vaccine we get, I think, will be tied to the percentage of data entry of the total number of cases being vaccinated. So it's really important, and we're trying to facilitate. We're not trying to scold somebody for not being good at it. We're trying to be helpful because about 18 states, I think it is right now, WebIZ. You probably remember because you guys passed a law that mandates the use of WebIZ as the immunization portal, and we use it for that purpose for all vaccines, not just COVID-19, and it's a common one around the country. And then the CDC goes into that site and scoops out the data and uploads it into their systems, and that's why it's really important for transparency purposes and accountability and quality control to make sure that the information gets into WebIZ. So anytime we hear about difficulties with WebIZ, we want to help them solve it.
So what's your launch date on this new website that you're talking about?
It's up and running now. The Kansas
For the
Vaccine,
vaccines?
kansasvaccine.gov. Yeah, it's got a lot of information. It has the vaccination plan. It's got the prioritization document. It's got the rationale, the criteria that I mentioned that are on one of the slides here as to why, what kind of evidence is used to put patients, or I should say people, into different phases, where that comes from. We didn't just pull it out of thin air. It was very strongly recommended by the premier group that does this, the Advisory Committee on Immunization Practices, ACIP of the CDC, are the ones that come forward with that recommendation. We submitted our vaccination plan to both the CDC and to HHS, and back in October, and it was approved. That's on the website as well, so that you can peruse that as also.
Representative Epley?
Thank you very much, Madam Chair. Good to see you again, Dr. Norman, and thanks for spending a little time with us. We really appreciate it. I do have several questions, and I'll try to be brief. First is the phase 2 start. Is there a metric that's being used county by county on when they can start into phase 2? And if so, what is that metric? And who ultimately makes that decision? Is it the county health officer based on the amount of vaccine they have available? Or how do we arrive at when we pull the trigger on phase 2 in each county?
When a county says that all of the people in phase 1 that are desiring to get a vaccine have had it, that's when they will move into phase 2 and future phases, I might add.
Okay, and that's determination then is by the county health officer in each county, sir?
Well, it could vary. Some, it could be the county commissioners. It'd be more likely at the recommendation of the county health officers or the local health department director.
Okay, very good. Madam Chair, I have another couple of questions. Okay, thank you, Madam Chair. So then, Dr. Norman, on legislator vaccinations, there's been, you know, everybody looks to me as the only doc under the dome here when we're going to have vaccines available here for legislators. Many of these ladies and gentlemen travel from very far away, and it's very hard for them to get back for their phase 2 inoculation or vaccination that would be due maybe this week or next week. They would have to travel to and from. Are you aware of this need, and if so, would it be possible for KDH&E to schedule a opportunity for phase 2 legislators to get their shot here rather than going home to their home county? Or could they get it through Shawnee County Health, or how would that work, Dr. Norman?
Yeah, if the legislators are in phase 2 and we're in phase 2, the county of residence doesn't make any difference. We, in other words, if a person lives in Wyandotte and works in Shawnee, it doesn't matter. The local health department or the FQHC can vaccinate that person, even though where the vaccination is occurring. So it could be Shawnee County Health Department. If it would, I can make mention to the governor, Dr. Epley, that perhaps we could not only but also your staff, given your staff are also somewhat unable to control their environment, and therefore are in kind of close contacts, we would also consider them to be a good likely person to receive that vaccine as well. And we'll talk to the governor about that.
You know, Secretary, and again, I'm just kind of pleading in that most of my colleagues at least think they're pretty busy, and I think they are. It would be helpful if they could have ready access to vaccinations, either literally here under the dome or a site nearby that KDH&E could provide. So I just beg you to consider that, think about that for those legislators that are anxious to get a vaccine that meet criteria based on phase 2.
And sir, if I may add, we do mobile clinics, so that mobile vaccination clinics, so this isn't out of the question, as you know.
Well, I would certainly urge you to give that consideration, and if you have any date in mind, if you could have Ms. Dunn or someone communicate with me directly. That I just get a lot of questions about this from my colleagues, and I get tired of not having an answer for them. So, question 3 would be, Madam Chair, if I may. Thank you very much. Senator Hildebrand touched on this, and you know, I think there was some press about a week ago, 10 days ago, because this is very fluid, that we were last last as far as administration in the United States. And I understand that that's not really, that was a misrepresentation and that we were not last. Just for the press today and for everyone that's here today, where does Kansas rank? You had mentioned that we were, I believe, 60% doses sent out have been administered. Nationals 39%. Where do we rank in percent administered as of today? Do you have any metrics on that?
Oh, yeah. Matter of fact, in the slide deck, it shows a map of the United States and where each is, because there's 5 different tiers. Last week, we were in the first tier on the doses per capita. The first tier, meaning the best tier. We slipped down to the second tier this time. We need to have enough vaccine in order to, on a per capita basis. We can't get to the top tier if we don't have enough vaccine delivered to us by the feds. But we're in the second tier. It probably would put us right about in the middle part of the United States. We were never at the bottom. It was a data feed problem from WebIZ. And so to go from one day at quote unquote the bottom into the top tier happened in a 1 week period with fixing the data feed.
And then thank you, Madam Chair. Last question for you, Secretary Norman, is, and this is maybe a positive question. Again, trying to facilitate getting vaccines out, do you feel that you have enough resources at this time and enough help to get these out on a robust basis? Also, segueing back into communication so that we can have maybe better communication with our senators and our representatives on where we are and really what's going on a more daily basis from legislative liaison from KDH&E?
We do have the resources we need. Matter of fact, you remember the president signed a bill on the 28th of December. Remember the clock was ticking on that. And we are scheduled to get the money today. That finally worked its way through that process. A couple things about the communications there. One is you all get this daily vaccine briefing. It's sent to you every day. And it's also available on the ks.gov website. It tells how many doses are given, et cetera. The other thing, though, and I think apropos of your question, Dr. Epley, KDHE would like to offer weekly updates to the Joint Committee. I think that would allow us to give you timely information hot off the press and be consistently available to you. And to Senator Hildebrand, I apologize for not having those immediate turnaround. That would help us to get more responsiveness, because I certainly want to have our agency be responsive to you as a legislative group.
Thank you very much, Dr. Norman. Thank you, Madam Chair.
Secretary, the problem that we're having with the, holding joint meetings is the committee members having, an additional meeting on top of the 3 or 4 that they're already responsible for. So I think what we're looking forward to is, being you're coming in via remote, is that to get an update from you at our regular scheduled meeting, perhaps once a week, which mine happens to be at 1:30. I believe the senators is 8:30 in the morning. Because I think that would be very helpful for all of our members. Representative Blex.
Thank you, Madam Chair, and thank you, Dr. Norman, for being here. And I do appreciate you elevating legislators to higher priority as those can find. One of the things that have received a lot of questions from is, how do I get the shot? And it seems a lot of confusion between the local health providers and the county health departments. The county health departments will say, call your local health provider, and vice versa, and they're running this tag back and forth, and nobody seems to know what's going on. What's being done to kind of eliminate this confusion out there in the rank and file of the clinics and the health departments?
Well, phase 1 has been a fairly confined group of people. It's been hospitals, local health departments, and FQHCs for the most part that have gotten all the vaccine. And are you asking, sir, about healthcare providers themselves as to where they get it, or people in general, more general population?
Well, I think it's both. It's mainly the public that will be calling their local health provider and says, I'm ready for my shot, I'm of age, I'm qualified, and the local health providers will refer them to the county health department. who in
Right.
turn sometimes don't know either. And I guess there's a point out there that it appears that nobody seems to know where I can get my shot.
Well, if that's the case at the local level, there's no excuse for it. We meet with everybody on a Thursday at 10 o'clock. We've been since March, and they know the FQHCs, the safety net clinics who have the vaccine, and the local health departments that's where the vaccine at this point in time resides. And that's their obligation. We have doctors, for example, psychotherapists, et cetera. I had just the other day that in town here who they go in through, in this case, they went in through Stormont Vale, and even though they have no affiliation with Stormont Vale. So we encourage hospitals as well to, as long as the needs of their employees or healthcare providers, as well as the healthcare associated persons like environmental housekeeping staff, food service, and the like, because they are in touch with COVID-19 patients every day. They can get it at the FQHCs and the health department. The fact is, the problem is there's not enough, and that's been the thing we've not been able to slay yet, because we're just dependent. I didn't answer an earlier question. I can't remember who asked it. We get where does the allocation come from? We get 1% of the allocated amount. Kansas has 3 million persons, and the U.S. population is about 330 million, and we get 1%. Sometimes we get shorted a little bit depending on what's coming through the supply chain. But then again, when we get shorted, if there are shortages coming through the supply chain, other people are being shorted as well. It's I won't say misery loves company, but we oftentimes have had even 50% of the allocation has been promised even just a week earlier. And it's really too soon to call, I think, on a major change tomorrow, obviously, with an outgoing and an incoming president. And we have not really been briefed yet on what, if any, change there will be. I have calls every week with General Gustav Perna, the 4-star Army general running Operation Warp Speed. And he says that we will maybe see a little bit of an uptick, but only 1% or 2% in the short run. So these shortages are going to be something we have to live with. Now, the next phase is going to be completely different. We know, for example, that about a third of Kansans are in phase 2 because of age, medical conditions, and the like, congregate settings, et cetera. So there'll be a big push. And to that end, and just last week, we had the final conversation with Operation Warp Speed about getting into the pharmacy chains, because we now have the approved beyond CVS and Walgreens that are vaccinating the long-term care facility residents. We now will have many more pharmacy sites available through Walmart and Kroger, and there's a long list of those. So we're very pleased. And it curiously, it's just coming now. This was just finalized at the end of last week to have this federal pharmacy partnership program, which will open it up. We also, in our provider manual, have information for doctors, medical clinics, mostly it would be medium or larger medical groups that can, and they are applying and are being granted vaccinator status as well. They have to be able to put data into WebIZ. But that alone will open up, it is opening up. We already have, I think, the last time I checked a week ago, I think we were right at 300 vaccinating sites around the country. And some are quite high volume. Some do 1,500 to 2,000 people a day. But we stand to increase that dramatically as we get into the future phases, especially phase 2, because there'll be such an increased demand. Will there be any more vaccine? I don't know. Does it make sense to bring on board 100 people or 100 entities to serve as vaccinating sites if we don't have any vaccine to give them? That's not very gratifying. So the thing to watch is the vaccine supply.
Senator Steffen? Did I pronounce that correctly?
You did very nice. Thank you, Chairwoman. Secretary, I appreciate your time. I want to walk through the children. They've borne a lot of the collateral damage, and I have a lot of concerned constituents on where we're headed with bringing them more damage. A series of questions. How many Kansans between ages 0 and 18 have died from COVID-19? Do you have that number?
I don't have it on the top of my head, but it's a single-digit number, I don't know.
I apologize for setting you up on that, but it's zero.
Okay.
Zero to 18 have passed away. As such, again, there's some setting you up. I apologize. What's the mortality rate for the virus among this Kansas age group? Well, the mortality rate is zero, obviously. So to the vaccinations, where does your administration stand with recommending the children be vaccinated?
They cannot be vaccinated because that would have to be an off-label, unapproved use. One vaccine has 16 and older, and the other one 18 and older, but nobody can be authorized below age 16 or 18 unless it's what's called an off-label use, which is done in an EUA-approved vaccine with a certain amount of peril. So we don't anticipate vaccinating kids until we do, until there's research. Until there's research.
There's no scientific data to support it, correct?
Right.
Yeah, thank you.
Senator Thompson.
Thank you, Madam Chair. Quick question as regard to how much latitude these local health officials have with deciding who to give vaccinations to. And with regard to that, I've got a constituent who sent an email some time ago. She's 66. She would fall into phase 2. But her son has Down syndrome, and she would like to allow him to step ahead of her. In fact, the CDC said on December 23rd that Down syndrome people should be placed in a high priority group. I didn't see it in the phases. How do I answer this lady's question? She would like, she takes care of her son. He's in his 30s, obviously has severe pulmonary issues. And could she go to the local health department and defer her or allow her son to take the vaccine in her place? What's your policy with regard to that?
According to, so he's a 33, you said an adult?
34, yes, absolutely.
Okay. I think I know who you're talking to. I actually talked to them on the phone. That patient would, that young man would fall into phase 3, but to your question, the local health departments and the medical officers have a certain amount of latitude to elevate somebody if they view that it's a significant enough risk. So
obviously with the guidelines in these phases, they're very broad groups. Do you anticipate that people like that would get any pushback?
I wouldn't think so. I think that's a pretty compelling case. A healthy Down syndrome individual at age 33, it would be more difficult. But as soon as you bring in underlying pulmonary issues and the like, and you bring up, Senator Thompson, a really good point, and that is with when we talk about medical conditions, whether they're severe or less severe, there's no bright line between those two. And what we do, and I don't know if you've seen it on our website or not, but the prioritization document, which is, I think, excellent, and brings in the best principles of research and evidence. There's still not a bright line between what's severe and less severe. And what we will rely on the local organizations to do, or the local clinicians for that matter to do, is to say, well, this is a lot like this. In other words, if somebody has pulmonary fibrosis, are they actually, pulmonary fibrosis maybe isn't a listed condition, but does it act like cystic fibrosis? If that's the case, it's a put them in the same category. So it will require, but then again, that's not new to medicine and public health. It always requires a bit of judicious thought and then weighing the evidence. And then, quite honestly, and especially in this time of shortage, if we're giving it to somebody or some group, then somebody else isn't getting it. So what's the impact on the person that's not getting it? And those are hard decisions to make. But I think that's why we have local health departments. They know their communities, they know their families, and are more likely to, certainly, and we don't dictate that from the state. We give guidelines.
So I'm sorry, Madam Chair, just this last one. So you wouldn't expect those local health officials to feel constrained by state guidelines? In other words, you feel like you're giving them and they know they have the latitude to make those decisions?
Yes, and the provider manual is pretty clear about that as well. There's a provider manual for local health departments, and there's a separate one for medical providers and the like. And it's replete with language about kind of call a judgment call, if you will.
Thank you. Thank you, Madam Chair.
Representative Parker?
Thank you, Madam Chair. Thank you, Secretary Norman, for joining us. This is all very helpful. Madam Chair, I have one question, although I wanted to preface it by saying with more than 24 legislators on here and us being more than halfway through our hour, if we had time to allow Dr. Norman to give his presentation, I'd be happy to step aside with my question and save it for the next weekly update. I really appreciate their willingness to do that. So we put that to you, and then if there's not time for the presentation, I'm happy to go ahead with my question.
You can go ahead with your question. We're in question period right now. Presentation has been sent to all the members.
Thank you. Dr. Norman, I just wanted to ask of you and your staff, there's a lot that we do as an oversight role here as legislators, but are there any things proactively we can be doing to help with the vaccination process, whether that's legislation or just as elected officials, helping to disseminate accurate information? If you had an ask of us moving forward to, help Kansas do the best possible with the vaccination process, what would that be?
That's a great question, sir. The one thing I think, and I realize that vaccines are always controversial. There's people that are vaccine enthusiasts. There are people that are vaccine hesitant, as we say. And then people on a gradation in between there. And there have been some things that have worried people about this vaccine because of the rapidity. The research wasn't shortchanged. What has been more rapid has been the manufacturing and distribution of it. The research is rock solid. One of the things that I think would be really helpful is for any leader, and you guys included, would be to lead by example, and either in spoken word or being vaccinated and talking about it yourself. I will never criticize somebody for not getting a vaccine if that's what their conscience tells them or their learned life lessons tell them not to do. I try to remember that why do people get vaccinated? And they get vaccinated because they're afraid of a disease. Why do they not get vaccinated? Because they're afraid of the vaccine. And I think that leaders talk about the different opinions in this situation. And I think that to the degree that nobody's polarized on one, polarized on the other, but can meet in the middle, I think those kind of community conversations and I think are very powerful because they're more likely to believe their faith minister, their faith leader. They're more likely to believe their Chamber of Commerce person or their next door neighbor than they are Secretary Norman. I recognize that. So I think it's really critical. That's why the Kansas Leadership Center, Mr. O'Malley and the gang, I think have been doing such strong work. It was at our suggestions that be considered, by the way, to push out to the local levels. That came out of the Harvard Global Health Initiative. They called it fusion cells. We thought that sounded too fancy and thought maybe just conversations was a better phrase. But I think it's really important for you guys to kind of press the flesh and share what you know and have open talk about it. I think, and then if you choose to get vaccinated and you have a smooth sailing with it, I think that's a very powerful message as well.
Senator
Thank you.
Gossage.
Thank you, Madam Chair.
Thank you, Madam Chair. Mr. Secretary, thank you for this presentation and for taking our questions today. Mine follows up with, we understood from an earlier testimony that there were 10 to 15% of physicians who were offered the vaccine who did not take it, and we were told 40 to 50% of the nurses did not take it. Now, we realize that was with the Pfizer vaccine. Has that improved with the Moderna vaccine? And then I have a second follow-up, if it's okay.
Yeah, there has been vaccine hesitancy, but I think it's important to understand why. Some people say this was rushed. Doctors and nurses are humans too, believe it or not. And some people have just said it has moved too fast. I'm going to take a wait and see. I've been in the trenches for a year now taking care of COVID patients. I'm very attentive to PPE and then into my private life. I can continue to manage just fine. I want to watch it for a couple more months. Most of the healthcare providers that are not getting it, it's not refusal, it's a deferral. So that's number one. Yeah, there was a little bit of information. Oh, there we go. Sorry, I somehow got muted. There's also a lot of healthcare providers who've gotten sick from COVID-19, and some have died. But those people, healthcare providers tend to be somewhat altruistic. And I heard from many people, Lee, what about just defer and let people that have not been ill and therefore presumably immune, can I just let them go first? I say, yeah, just defer. And you'll notice in the prioritization plan that workers that didn't get it in an earlier phase can get it in whatever phase we happen to be in. So we're picking those up. I did have one small hospital which had only 36% of its healthcare persons in the first couple of weeks that chose to get vaccinated. Today, it was in talking with the larger hospitals, they're over 70% in most of the hospitals. We've done our calculations on the basis of about a 30% either refusal or delay. And by the way, that's true for non-healthcare persons as well. I think it's just going to see a gradual uptick as time goes on because it's been a very successful campaign already and very few side effects.
So we've had enough people now that have taken the vaccine. What have we seen or reported to your office regarding adverse reactions to the vaccine?
Yes, good question. There is a formal reporting system in place, and we are in that chain called the VAERS, Vaccine Adverse Event Reporting System. And so we get optics on that. And mostly it's the stuff that I suspect you've read about with a sore arm, maybe a day or two of kind of fatigue or achiness. That's very seldom happening after the first dose. It seems to be happening after the second dose more commonly, and that's true of vaccines. It also, we have quite a few people, of course, with the number of COVID-19 people we've had that are now getting vaccinated. They seem to have a little bit more of a achiness, maybe take a day off work or have a low-grade fever and soreness at the injection site. So, but it's been really quite good.
And what have you told people who have had COVID and have recovered from it and feel that they now do have immunity? What are we saying to those about the vaccine?
What we are following is the advice and counsel of the CDC, which is, one, we don't know how long the immunity lasts. We feel that there's pretty good evidence that it's 90 days, but it may not be dramatically longer than 90 days. If you want to postpone the vaccine for 90 days and then get it the prime dose, then that's probably a fine strategy. If you're within that 90-day window, then you can get it at any time, the vaccine, as long as you're in the phase of the group getting vaccinated. I think it is kind of a selfless or altruistic thing to do to postpone it to allow people that are absolutely unimmune or susceptible, therefore, to get the vaccine first.
I apologize. My final question, Madam Chair, is do we consider independent living senior facilities as nursing homes? I point this out because my mother has not been out of her facility since March. She's 90 in an independent living facility, drives a car, but has not been offered the vaccine.
Is she in assisted living, did you say?
She's in independent living.
And does she eat meals with other people? Or
She does.
Yeah, then she would be considered long-term care because that's essentially a congregate living situation.
So the facility should be looking into getting those, allowing them to be vaccinated if they so choose, correct?
Yes, that's true.
Thank
Do you know? Yeah, the federal program that we are with is CVS and Walgreens, and they're the ones providing the vaccine to the long-term care facilities through contract with the federal government. We're not in the middle of that, but we do want to make sure. There are some orphan facilities that are not a part of that, and that is our obligation to immunize those people, and we take that as our charge.
Thank you. Thank you, Madam Chair.
Senator Hildebrand.
Thank you, Madam Chair. And Mr. Secretary, adding to the question, kind of following up for what Senator Gossage had, Senator McGinn had approached me with a very similar question, and she had said something about because it was private nursing or private help staff that was working in that congregate setting, that they were not part of the vaccination program with the rest of them. I do not know if that's CDC or the pharmacies that are doing that have made that determination, but that might be something for you to really look into, because I've heard it from 2 or 3 different sources that it has something to do with because of private nursing or private workers working there, that pharmacies are not giving them the vaccination.
Yeah, that I agree with you. That shouldn't be that way. That shouldn't be that way. It makes no difference if they're private or whatever the other categories would be. And by the way, if people are on Home Plus or other the PACE program, which is for the very vulnerable, high-risk elderly, they also are considered long-term care, even though they are not necessarily living in a long-term care facility. And it's for the same reason it was asked by in the prior question.
And I'm going to go to Senator McGinn has a question, and I believe it's kind of a follow-up with the last 2 we have, and then we're going to go to Senator Baumgartner.
Thank you, Madam Chair, and thank you for allowing me to participate. Appreciate the comments that were made. I too have a mother in independent living, and she's 90 years old, and they all eat together. They've been getting meals served to their room. I've been in conversation with KDHE for about 3 weeks now to make sure people recognize this population. They are private pay, so they pay for their the facility they live in, and if they need any health care needs, which are very similar to nursing homes, people on oxygen, people on walkers, people anywhere from 70 to 103, I believe. And I've been told that Walgreens and CVS cannot go in that facility. And so the difference is they're all private pay out of their own pocket to take care of themselves. They live in the same congregate setting as nursing homes, and they cannot get the shot.
Okay, I think what you're talking about is a non-CMS regulated facility, and if that is the case, then those same facilities have contracts with usually community pharmacies. They all have, every nursing home, whether it's CMS regulated or private, has contracts with pharmacies and that is our obligation to make sure that those pharmacies that they contract with have the vaccine in order to give it. We're blinded to whether it's CMS, the vehicle for getting the vaccine to them is different because it goes through a private community pharmacy. And we think it's important to continue to use them since they're the caregivers for those private folks. So they should be getting that immunization center.
Well, so far it's a roadblock. So just so you know, and if you could check into that, I'd sure appreciate it.
Sure, happy to do so.
Thank you, Madam Chair.
So, Secretary, are you saying then that independent pharmacies outside of CVS and Walgreens also receive their vaccines through another source, whether it's the federal government or somewhere else?
It's us. It comes in through the state allocation. I think it's around 25 or 30 facilities like that around the state, and that fall outside of the federal program and therefore not CVS and Walgreens, but a community pharmacy. And we're the ones to provide those community pharmacies with that vaccine.
So it seems like to me that we should be able to address Senator McGinn's issue because she's probably not the only one that's dealing with that in her community. Would that be correct?
That would be correct. Ma'am, if I may, Phil Griffin, who is the allocation guru, the leader of the allocation process, knows this better than I do. If it's okay with you, I would like to ask Phil to comment on this skilled nursing facility versus private basis.
Yes. So the long-term care facility quasi-types that we're calling orphan facilities because they did not meet the CMS guidelines, those we are taking care of. That's the 37 that you mentioned, first the 37 are long-term care facilities that opted out of the federal program. All the rest of the CMS classified long-term care facilities did opt in. Then there's an orphaned group, which is like the Home Plus and other state designated long-term care facilities that are nursing type facilities. Those are in phase one, and we've just recently got that list and are beginning to work through it. It's a case-by-case situation that we have to work with and match up the partner. If the pharmacy that normally deals with them is enrolled as a provider, we can go to that pharmacy. We're also working with local health departments to get vaccines through them to be able to vaccinate those populations, both staff and residents. And then there is a separate group of independent living group that is a phase two congregate setting because it is not a nursing home type facility. Those are more the oftentimes considered elder housing or retirement facilities, retirement communities for those of older, and those are the groups that they may have shared dining, but they don't have typical assisted living type of assistance, but they share an apartment building type with a common dining room. Those are congregate setting groups.
Senator Baumgardner.
Thank you, Madam Chair. Mr. Secretary, I think you can probably imagine with the discussion that we've just, we started, one of the first questions from Senator Hildebrand was what percentage of seniors that are in congregate settings have been vaccinated? We still don't know that number. And quite frankly, we're talking about Kansans. Kansans where their home is a congregate setting. Regardless of whether they're CMS regulated or non-CMS regulated, we need to know as legislators what percentage of those folks have been vaccinated, when those that haven't been vaccinated will be in line to be vaccinated because they have family members, loved ones that can't go in and visit them, that want to know when are they going to get what they feel is phase one vaccinations. And so it is very frustrating. We knew the number of residents back in March when we had our emergency session over the summer. We knew that congregate setting situations for our elderly were an issue. So it's not clear to me. If it's clear to my fellow members of this committee, I appreciate, maybe you can explain a tutorial, but how is it that KDHE and KDADS cannot figure out how to make sure that this population of Kansas residents that can't even get out and dine together when they're going to get the vaccination? So could you please answer for me how that is going and when that's going to be figured out? Because it doesn't sound like it's figured out yet.
Yeah, that's a fair question. Well, a couple of things. I was asked a question about what is the percentage. I'm not going to make up a percentage off the top of my head. That takes some research, and we have the ability to do that, and we need to pull those. And I don't know, maybe Mr. Griffin on this Zoom has those numbers on the top of his head. But, we're almost through with phase one. We're getting right down there, and I just don't have the number on the top of my head to share, but we have those numbers available. We know, for example, I told you the numbers earlier of the number of doses have been given. We know how many of those have come through the federal partnership program that is servicing the nursing facilities. We know how many allocations have gone to those pharmacies that are what Phil refers to as the orphan programs. I just don't have those in the top of my head. Happy to give those numbers to you because they are important. I agree.
Madam Chair, yes, they are important. And what you've already heard is just from legislators, this is their family member or their constituent. And it isn't so much what is the exact number today. It is what are the two agencies doing, the one that you oversee as well as KDAD's, what are those two agencies doing to make sure that every single day we are moving forward? Because it doesn't seem as if we're moving forward if agreements haven't been made yet for the non-CMS regulated facilities to have any type of pharmacy come in and provide those vaccinations.
I don't have the numbers off the top of my head, Senator. That's all I can say. We are enlisting and enrolling provider pharmacies all the time, and we will help with local health departments, as Phil pointed out, to get in there to do the vaccinations. And it's been a complicated process with the feds and with the different channels. I agree.
So
We do take it very seriously.
No one is saying that it's not being taken seriously. The concern is that sense of accountability. So are you checking on a daily basis or is there a weekly basis? How do we know? How can we have an assurance that we really are almost done with phase one if we don't know what the plan is to get some of these non-regulated facilities that have congregate living situations, that those residents, those Kansans will get vaccinated?
In answer to your question, we do meet on this 3 times a week, every Monday, Wednesday, and Friday. KDADS is with us on that. Obviously, they're the lead overseer of the nursing home accreditation and survey process. But we are the lead agency for vaccines, and we'll provide you that information. We'll find out the most hot off the press statistics or numbers or percentages to share with you.
Madam Chair, just one last question. I have gone to the kansasvaccine.gov website, and I think during the setting of this meeting, in looking through it, I cannot, in all fairness, say to my neighbors and my constituents, go to this site, because there's not anything in this site that's going to tell them, I live in Paola, Kansas, in Miami County, and this is where I can go get a vaccine, or this is how I know it's going to be available. So I think one of our biggest concerns is communication and the lack thereof. It is very unclear, even with your testimony, is it going to be the county commissioners? Is it going to be the county health official? Is it going to be the hospital? Where is it that residents in Kansas are going to know they are to go, they are to listen to, they are going to get updated so that they can go stand in line and get their vaccination? I understand we're not going to uniformly do it the same in every county, but there doesn't seem to be a consistent manner for any Kansans to know when and where they are to go.
We are not doing a statewide scheduling program, as I mentioned earlier, because the local officials and health departments, hospitals wanted to have their own ability to control how they ran their program. To the question in it is about the map. The map is not on that website yet because it's in the final stages of construction now, where they can hover over their county or their city and find out where their local resources are, and that will be what will drive them to the locations where they're going to get vaccinated. And they can even schedule from that if the local organization that populates it wishes to have their scheduling program embedded in that, then they'll be able to navigate through that as well.
Mr. Secretary, I just visited with my counterpart, Senator Hildebrand, and if at all possible, we'd like to do another joint meeting next Tuesday at the same time, if that fits into your schedule. Because I think that you can, understand and hear the frustration from us. I've got several legislators that have got questions yet, and we're going to run up against our time schedule here to get out. is I would ask that you all compile your questions, please. And if you will send them to your respective chairs, then we will make sure that those questions get to Secretary Norman, and then hopefully then answers will be there. Because I think there's, we've got the concerns of, one big question out there is we have a health department in Kansas that's refusing to give the vaccine because they've decided that they know more than anybody else on the vaccine. So where do people go for that? If you're here a couple of weeks ago at a press conference with the governor, you told us that KDHE is not inventorying the vaccine, so we're kind of wondering how you distribute them, how many do you know that you're getting, et cetera. Is there any communication at all then with any of these federals, whether it's CVS, Walgreens, or any of these other independents? So tons and tons and tons of questions, and we're getting them from our constituents. We're getting them from our hospitals. We're getting them from our doctors, and that's just very, very frustrating to me because I think that the lead agencies has had several months on this to, line things out. Is there going to be hiccups? We get that. But lack of communication should never be a hiccup in this process. So I know that some of you have, burning questions, and I wish that we had the time to get to them because that was only part of my questions. So let us know if next Tuesday works, and we'll get that set up for a WebEx meeting. Mr. Secretary, we appreciate you being with us here today, and look forward to a discussion next week.
Thank you, Madam Chair and committee. Appreciate it. And I haven't looked exactly yet, Madam Chair, but I do everything I can to clear that time period so that can occur. Thank you.
All right. Well, we would appreciate it, or at least somebody from your office that can answer those questions.
Yep, I got it.
All right, committee members, I want to thank everyone that was here on WebEx today and those that were here in the room. Obviously, an hour is not enough time to get through the information that's needed. I have felt the frustration, when I'm getting the information through the press, and they're not getting all the information because we actually had the belief that CVS and Walgreens didn't have the vaccines, and when I made calls to those individuals yesterday, guess what? They do indeed have the vaccine. So it's a lot of miscommunication, misinformation, and hopefully we can get this straightened out. So please get us your questions so that we can get them to the secretary, and then he'll have the answers for us next week. Are we good? Adjourn.